From high atop Healthcare Hill in Central Maryland, this is BSN Headline News. Today's top story is Bon Secours facilities reach Stage 6 in the HIMSS US EMR Adoption Model in 2010. HIMSS Analytics, the authoritative source on EMR adoption trends, devised the EMR, or Electronic Medical Records Adoption Model, to track EMR progress at hospitals and health systems. The HIMSS EMR Adoption Model scores hospitals in the HIMSS Analytics Database on their progress in completing the 7 stages to creating a paperless patient record environment. This past week, we were able to corner Lacey Williams Carlson long enough to get some details on what Stage 6 is and where we go from here. Lacey Williams Carlson is the Vice President and CIO of Enterprise Applications and has the information systems insight into achieving this notable milestone.
I'm Lacey Williams Carlson. I'm a CIO in the Bon Secours Health System, and I work on our ConnectCare team, helping with our exciting implementation, rolling out the electronic medical record across all 14 of our hospitals. HIMSS has what they call an EMR adoption model, and it's a framework that they've set up that has 7 stages, from the barest use of information technology in a hospital all the way up to Stage 7, which would be a completely paperless environment and would signify the highest, most sophisticated use of medical records to improve patient safety and outcomes. We just received a designation for those hospitals that are live on ConnectCare for what's known as Stage 6 of the EMR implementation model. In fact, just this week at the annual National HIMSS Conference, we were recognized in a reception along with other health systems who have reached Stage 6 designation. We are among a very elite crowd. Fewer than 4% of hospitals in our country have reached Stage 6 or Stage 7 designation. So I think that the EMR implementation model correlates nicely with clinical transformation in Bon Secours. We view ConnectCare as a tool in our tool belt, maybe a big tool, towards clinical transformation. And now we have both the tools at the caregivers side to provide them assistance, as well as data that helps us to focus our improvement efforts. What I would like to acknowledge is that this is the culmination of a long journey for us using information systems successfully in Bon Secours. ConnectCare was, while albeit a very important piece on the top, was not the only piece. It measures things like using PACS system and digital images, having structured lab data, certainly having the infrastructure that allows us to do all of this. So what was really exciting to me about getting the designation is that it recognized the work that our colleagues have been doing throughout the system for a decade.
Please join us in congratulating everyone for their efforts through clinical transformation that helped bring this Bon Secours adoption of electronic medical records to Stage 6. Clinical transformation is working as demonstrated in these results, and our ConnectCare implementation forges ahead to support all of us as we provide good help to those in need. In other news, on February 12, 2011, ConnectCare went live at Good Samaritan Hospital's ED. ConnectCare is Bon Secours' integrated system that makes it possible to link all clinical information in one record. It also provides leading clinical practices and information to enhance our ability to provide superior quality and services to our patients and physicians, resulting in enhanced operating performance and outcomes, thereby playing a significant role in achieving Stage 6 of the HIMSS EMR Adoption Model. ConnectCare's vision is to achieve world-class outcomes, enable caregivers to provide superior, consistent care, and enhance operating performance by leveraging leading clinical practices through an integrated system of clinical information. And Good Samaritan Hospital's ED in Suffern, New York, part of Bon Secours' Charity Health System, is the latest to go live with ConnectCare.
ConnectCare is successfully live in our 2 Greenville hospitals. Of course, they were the first to go live, and Dr. Howard and others can just tell you phenomenal stories about improvements in ED metrics and other things that we've done there. It is in use in 3 of our 4 Richmond hospitals, and our 4th goes live at the end of March. And St. Mary's and Community and MRMC have already achieved phenomenal things there. It just went live in New York in our ED at Good Samaritan Hospital, and that was a pleasure to work on that project. The ED clinicians there were so excited to be getting that technology and wanted to address some operational and clinical issues in their ED. So that's just fresh live for 2 weeks. Awesome, awesome implementation. And of course, ConnectCare is also live with hundreds of physicians in their practice sites across Virginia, and recently just the first site in Kentucky. We are moving very quickly now, and we're sort of at the peak of the frenzy around implementation. You know, we still have quite a few hospitals to go, but it's a challenging period because you're trying to circle back and keep up with the hospitals that are already live and using the system in which to optimize, and yet you still have more hospitals to get to who haven't yet got the system in use in their local system. So it's the good news is that we have plenty to do. We're never bored. And the systems in which we're working are so excited about ConnectCare and what it brings to the table.
You can find out more about ConnectCare on IRIS. Look for the Enterprise ConnectCare link under Key Communities in the mega drop-down list on any IRIS community. ConnectCare, part of clinical transformation, continues to move forward, helping us be good help to those in need. Finally, Commitment Day. What is it? Why have it? And where will it take place? You may not have heard much about Commitment Day yet, but it is coming. Commitment Day is the kickoff of Bon Secours' new Healthy Me, Healthy You employee wellness initiative. Commitment Day is when we invite Bon Secours employees to make a commitment to better health. Healthy Me, Healthy You is a new BC-wide initiative to promote employee health and wellness. Why? Because good health starts with healthy caregivers. Bon Secours is committed to the good health of our communities, and one of those communities is the community of Bon Secours employees. And in order to help us be good stewards of our personal health, Healthy Me, Healthy You will kick off in March with the message that good choices can lead to better health. Commitment Day will take place across the Bon Secours health system the week of March 20th for most facilities, in conjunction with the beginning of spring, a time of renewal and rejuvenation. Bon Secours cares about the health of you and your family and encourages everyone to participate in activities that will be taking place at each local facility. Watch for details locally as we approach the beginning of spring, and here at BSN Headline News, we will keep you updated on what is happening across the system. Good help to those in need is something we all want to support, but it does not start without a healthy you. Well, that's it for this week. Stay tuned to this portal for future up-to-the-minute information on these and other stories on BSN Headline News. I'm Dave Schlachter. Thanks for joining us. BSN Headline News is a production of Bon Secours Productions and is solely responsible for its content.